Welcome to today's episode of Pharma Newsroom, your easy insights into all the biggest pharma companies in the world. We thank today's sponsor, Pharma AI Academy, your education partner for pharma.
All right, so are you ready for this? We are diving deep into AstraZeneca's performance in 2024.
Yeah, it's going to be interesting because we're going to uncover the story behind their numbers.
That's right. We're talking about where AstraZeneca and maybe even the whole pharmaceutical industry is headed.
Absolutely.
Okay, so we're going through AstraZeneca's full year and Q4 2024 results announcement.
Which is a gold mine, by the way.
Yeah, absolutely. We've got financials, pipeline updates, insights from their CEO, Pascal Soria. It's all here.
So yeah, if you stick with us, you'll know how AstraZeneca did, where they're going next, and get a peek into the future of healthcare. It's exciting stuff.
It is. It's all connected, right? Each success, each setback, we'll see how it all fits into the bigger picture.
Exactly.
All right, so let's start with the big picture first. AstraZeneca had a 21% increase in total revenue. That's huge.
Yeah, it is big.
$54 billion.
Wow.
And their core EPS is also up a healthy 19%. They're even planning a dividend increase for fiscal year 2025.
Yeah, they seem to be feeling pretty good about the future.
And looking at the details, it's easy to see why. Oncology is a powerhouse for them. It grew 24%, and now it makes up 41% of their total revenue.
That's a big chunk of their business.
It is. And, within oncology, there are some real standout performers. Tagrisso, Imfinzi, Lynparza, impressive growth. But the one that really jumps out is in HER2.
Oh, yeah.
A whopping 58% growth.
Wow.
This drug is on its way to becoming a mega blockbuster, wouldn't you say?
It really is. And it's a great example of how these new targeted therapies are changing cancer treatment.
Yeah.
Imagine a treatment that can zero in on cancer cells so precisely, minimizing damage to healthy cells,
right,
reducing those nasty side effects.
Yeah.
That's in HER2.
That's the power of this new type of medicine.
It is, and that's why everyone's so excited about it. And it also shows us another big trend that's happening, collaboration.
Okay.
In HER2 is actually a joint effort with Daiichi Sankyo, and their combined sales hit $3.75 billion.
Wow.
So yeah, these kinds of partnerships, they're becoming super important for developing new drugs.
Partnerships to watch for sure. But oncology isn't the only area where AstraZeneca is doing well. They've also seen solid growth in cardiovascular, renal, and metabolism, or CVRM, 20% increase there. And in respiratory and immunology, R&I, a 25% jump.
That's right. Farxiga is doing really well in the CVRM space, and Symbicort's still a leader in the respiratory market.
Yeah.
So those established drugs, they're a solid foundation for AstraZeneca's growth.
Exactly. And we can't forget about rare diseases, right? They had a 16% bump overall.
Yeah, rare diseases are definitely an area of focus.
Ultomiris is the star there. It grew by 34%.
Incredible growth.
Which more than makes up for that decline in Soliris, right?
Yeah.
I mean, that was expected as patients transitioned to Ultomiris, the newer, better treatment.
Yeah, exactly. Sometimes a decline in sales for one drug isn't a bad thing at all.
Yeah, it's all about the context.
Yeah, it can mean they're successfully switching patients to a better treatment within their own company.
Exactly.
Understanding the market is key.
Speaking of the market, there were some shifts this year. AstraZeneca's revenue in China dipped a little.
Oh, interesting.
Makes you wonder, should we be concerned, or is it just a temporary thing?
Yeah, I think it's worth thinking about. The report says it could be because of lower respiratory infection rates in China and maybe some budget issues at the end of the year in hospitals. So it might be too early to worry. But we'll definitely keep an eye on it.
Agreed. Okay, this is something that really stood out to me. AstraZeneca is investing a lot in what they're calling transformative technologies.
Yeah.
What are these technologies exactly?
Well, that's what's so interesting. They're thinking long term. It's not just about the drugs they have now.
Right.
They're investing in things that could completely change how we diagnose and treat, even prevent diseases in the future.
It's like they're looking way ahead.
Yeah, they are. One example, using AI in drug discovery.
Oh, wow.
Imagine analyzing huge amounts of patient data, finding patterns to figure out which drugs will work best for each person.
Okay.
That's what we're talking about here.
It's like something out of a sci-fi movie, but it's happening now.
It is. And it's going to change how we think about healthcare in a big way.
Absolutely. Okay, so let's move on to some specific developments in AstraZeneca's pipeline.
Sounds good.
In terms of regulatory wins, Imfinzi got approved in both the U.S. and Japan for limited-stage small cell lung cancer. That's a big deal because it means more patients with this aggressive cancer will have access to a treatment that could save their lives.
It's a huge win.
And that's not all. Calquence also got approved in both countries for mantle cell lymphoma. Plus, it got approved in the U.S. and Japan for a tablet formulation for chronic lymphocytic leukemia. Having different options like that is important for patients.
It is, yeah. Especially when it makes taking the medication easier for them.
Right, exactly. And Datroway, their drug for HR plus ATR2 metastatic breast cancer, that was also approved in both the U.S. and Japan.
Yeah, that's another important win.
To quickly explain, this means the cancer cells test positive for hormone receptors, but negative for a protein called HER2.
Right, it's a specific type of breast cancer.
And then there's Enhertu. It was approved in the U.S. for chemotherapy-naive HER2 low and HER2 ultra-low metastatic breast cancer.
Oh, wow.
So it can now be used as a first-line treatment.
That's a significant development.
It is. Oh, and we can't forget about Europe.
Right.
Tagrisso got approved there for unresectable EGFRM and a CLC. Just to break that down, it's non-small cell lung cancer that can't be surgically removed and has a mutation in a specific gene, the EGFR gene. And Tagrisso targets that mutation directly.
Makes it a very effective option for those patients.
And then there's Cavigal, their preventative treatment for COVID-19. That also got approved in Europe.
Right, because the fight against COVID-19 isn't over.
It's not.
Yeah.
Okay, let's talk about clinical trials.
Yeah.
Tagrisso had really good results in the NeoAdara trial for early-stage lung cancer.
Oh, that's great to hear.
It could mean Tagrisso becomes a standard treatment option for patients diagnosed early.
Which could really improve outcomes.
Exactly. And TrueCop, their drug for prostate cancer, had a win in the Capitello 281 trial.
That's great news. It shows how much work is going into finding better treatments for a disease that affects so many men.
It is. It's encouraging to see these advancements. But, drug development is not always easy.
That's true.
AstraZeneca also had a setback, unfortunately. They had to terminate their Vimircopan program.
Oh, yeah, I remember reading about that.
The decision was based on safety and efficacy concerns. Reminds us that developing new drugs is really complex and challenging.
Yeah, you can do all the research and still sometimes things don't work out the way you hoped.
Exactly. But let's move on to the financial side of things. The report says product sales gross margin stayed pretty stable.
Yeah, generally stable.
But it was affected by the growing number of profit-sharing collaborations.
That's interesting. It seems like more and more partnerships are happening.
Yeah, and it makes sense.
Yeah, drug development is expensive, so sharing resources and expertise can help. But it also means sharing profits.
All about balance.
Yeah, finding that sweet spot.
And speaking of investments, AstraZeneca's R&D spending went up a lot this year. The report says it's because of their pipeline and investments in new technology, so they're clearly committed to innovation.
Absolutely. They're not just looking at short-term gains. They're thinking about the future of healthcare.
Yeah. And before we wrap up this first part, there's one more thing I wanted to touch on. The report mentions an ongoing investigation in China.
Oh.
It's about alleged illegal drug importation. What's the latest on that?
Well, AstraZeneca got an update in January. The Shenzhen City Customs Office is saying they owe unpaid import taxes on two of their cancer drugs, Imfinzi and Imjudo.
Okay.
AstraZeneca says they're fully cooperating with the Chinese authorities, but the investigation is still ongoing.
So we'll have to see how that develops. All right, I think we covered a lot in this first segment. We've looked at AstraZeneca's overall performance, their successes, their setbacks, and some of the big trends in the industry. When we come back, we'll explore what all of this means for the future of healthcare. Stay tuned.
I can't.
Okay, so we're back, and now we're going to really dig into what AstraZeneca's 2024 performance tells us about the big picture, like the whole pharmaceutical industry.
Yeah, there's a lot to unpack here.
For sure. So what do we learn from AstraZeneca's success, especially with those ambitious growth targets they have? What's it say about the state of the pharmaceutical world?
Well, one thing that really stands out is how much AstraZeneca is investing in oncology. It's definitely their biggest growth area, and they're putting a lot of resources into it.
Makes sense. Cancer is so complex, and there's always a need for new and better treatments.
Exactly. And this leads us to another big trend, the rise of personalized medicine.
Personalized medicine.
Yeah, it's moving away from that old one-size-fits-all approach where everyone with the same condition got the same treatment. That's changing.
I'm curious, can you explain that a bit more? Like, what does this shift to personalized medicine actually look like?
Sure. Think about those drugs we were talking about, like Tagrisso and Lynparza. They target specific genetic mutations in cancer cells. So they're way more effective for patients with those mutations, and they often have fewer side effects compared to traditional chemo.
So it's like tailoring the treatment to each person's genes.
Precisely. It's like getting a suit made just for you instead of buying one off the rack.
Yeah.
And those transformative technologies AstraZeneca is investing in, they really highlight this trend. It's not just new drugs. They're investing in the tech that will help us find the right drug for the right patient.
Like using AI, right, to look at tons of patient data and spot patterns that we might miss.
You got it. AI and machine learning could totally revolutionize how we diagnose and treat diseases.
Leading to
more accurate diagnoses and personalized treatment plans.
It's incredible, really.
It's a really exciting field with a lot of potential.
It does sound like science fiction, but it's happening now.
It is. But, with all this cutting-edge technology and personalized medicine, it makes you think about the cost.
Yeah, for sure.
Drug development is already super expensive. Will this focus on specialized treatments make things even more expensive? It's a valid concern.
It is a big question. How do we balance the need for these new treatments with making them affordable? How do we make sure everyone benefits, not just people who can afford it?
It's a tough question, but there are things we can do. For example, drug companies could try different pricing models, maybe tying the price of a drug to how well it works.
So like if a drug works really well for someone.
Yeah, the price could be higher, but if it doesn't work as well, then the price would be lower. That's called value-based pricing, and it could help make those treatments more accessible.
Interesting. So shifting the focus from just the cost to the actual value the drug provides.
Exactly. We also need to find ways to make drug development faster and more efficient that could help bring costs down.
Okay.
And of course, the government has a role to play too.
Right.
Negotiating drug prices.
Making sure.
Yeah. Making sure that essential medicines are affordable for everyone. It's going to take everyone working together.
Yeah. Sounds like it. It's got to be pharmaceutical companies, policymakers, healthcare providers, even patients themselves.
Right. We all need to be part of the solution because we all have a stake in this. We have to make sure everyone has access to these life-changing treatments that are coming out of this amazing time in medical innovation.
Absolutely. Okay, so we've talked about personalized medicine, those transformative technologies, and the cost of all this innovation. But let's not forget about AstraZeneca's focus on sustainability. They seem to be taking a more holistic approach, not just thinking about the science, but also the impact on society and the environment.
You're right. It's not just a buzzword anymore. Sustainability is something a lot of companies are taking seriously, and AstraZeneca is actually doing something about it.
They are. They have that Ambition Zero Carbon initiative.
Right. It shows they're committed to reducing their environmental footprint. They're using renewable energy, reducing waste, making their whole supply chain more sustainable.
That's impressive. It shows they're thinking about the planet.
They are. And they're also working on improving access to medicine in lower-income countries.
Okay.
They've got programs to make their drugs more affordable in places where healthcare isn't as readily available. Things like tiered pricing and working with governments and NGOs to get essential medicines to people who need them.
That's good to hear. It shows they're being responsible.
It does.
Recognizing that everyone deserves good health care no matter where they live or how much money they have.
Right. It's about making sure everyone benefits from these medical advances.
Yeah, making sure it's shared fairly.
Yeah, exactly. Now, before we move on, I wanted to circle back to that investigation in China we talked about earlier.
Okay.
It reminds us that even with all these good things happening, there are still challenges for the pharmaceutical industry.
Right. That investigation into those import taxes is a reminder that being transparent and ethical is really important.
It's crucial, especially when we're talking about people's health. Companies need to be careful to follow the rules and do things the right way.
So even with all the progress, we have to be aware of the ethical side of things, too. It's a balancing act.
It is. And speaking of balance, let's not forget AstraZeneca's goal of reaching $80 billion in revenue by 2030. That's a big jump.
It is.
What do you think about their plan to get there?
Well, they're definitely counting on their big drugs like Tagrisso, Imfinzi, Lynparza, and of course, Enhertu to keep doing well.
Mm-hmm.
But they can't just rely on what they have now, right?
Yeah.
They need to keep coming up with new treatments.
Definitely. And they'll have to deal with all the complexities of the global healthcare market, too. Every country is different.
Different rules?
Yeah, different rules, pricing pressures, different patients. It's a lot to manage.
It does sound like a tricky balancing act between science, money, and doing the right thing.
You said it. And with that in mind, let's move on to our last part, where we'll really explore what AstraZeneca's growth could mean for the company, for the industry, and most importantly, for patients everywhere.
Okay, so we're in the final stretch of our deep dive into AstraZeneca's 2024 performance. We've looked at their financials, those big industry trends, and even those ethical questions, right?
We have, yeah.
So now it's time to zoom out and ask, what does it all mean?
It's the big question.
It is.
Because data, without context, it doesn't really tell us much. But AstraZeneca's success and those ambitious goals, they paint a picture. The pharmaceutical industry is changing fast.
Yeah, we've got this surge in those super specialized therapies, more and more partnerships, and the lines between tech and healthcare are getting blurrier and blurrier.
Absolutely.
It feels like a huge shift is happening.
It really does. And that brings us to the biggest question, the one that really matters. What's it all mean for patients?
Yeah.
On one hand, we're seeing incredible progress, real hope for treating, maybe even curing diseases that we never thought we could.
Right.
Those personalized cancer therapies, the potential of gene editing for those rare genetic diseases.
It's pretty mind-blowing.
It is.
But we can't forget that all of this comes at a price, often at a very literal one. How do we make sure everyone benefits from these breakthroughs? Yeah. Not just the people who can afford them.
It's a huge challenge, and we need a multi-pronged approach. Governments, pharmaceutical companies, insurance providers, patient groups, everyone needs to work together.
Wow, that sounds like a massive effort.
It is, but it's necessary. We might need to completely rethink drug pricing, maybe tying it to how effective a drug is. And we also need to talk about how we value healthcare as a society. It's a complex issue, and it deserves a deep dive of its own.
Yeah, it does. But one thing's for sure, cost shouldn't prevent anyone from getting life-changing treatments.
Absolutely not. The stakes are way too high.
So as AstraZeneca is aiming to become a leader in this industry,
Yeah.
it's clear we're entering a whole new era of medical advancements with the potential to totally transform human health. It's amazing.
It is, but it's also a bit daunting.
It is.
We need to consider the bigger picture, the ethics, how it will impact healthcare systems, and above all, making sure these innovations help everyone, not just a select few.
Yeah, making sure these benefits reach everyone.
Yeah, exactly.
That's a really powerful message to end on. It's a reminder that the future of healthcare is about more than just science. It's about making sure everyone has access. Thanks for joining us on this deep dive. We'll be back soon with another one.
I'm already looking forward to it.